Welcome to this explainer. Today, we're diving deep into the definitive blueprint for starting a Cochrane systematic review. If you're a pharmacy student, a clinical researcher, an HEOR professional, or maybe a medical writer, well, this is built exactly for you. We're going to unpack the foundational principles from the Cochrane Handbook for systematic reviews of interventions. And we aren't just summarizing here. We're breaking down the methodology from first principles so you can apply this directly to your own health economics and outcomes research.
Think about this for a second. How do regulators actually decide if a new drug is safe and effective? With the sheer volume of medical research growing at this incredible rate, it's literally impossible for an individual decision maker to read every single primary research paper. And relying on just one or two clinical trials, that's incredibly dangerous because it just doesn't give you the full picture. So that's exactly where systematic reviews come in. They form the absolutely critical regulatory framework for real-world drug licensing, insurance coverage, and health technology assessments.
So we'll be following a highly structured path today. First up, the HEOR impact. Then, the PICO question. Third, the review team. Fourth, protocol power. And finally, data and quality assurance.
All right, let's jump right into section 1, the HEOR impact.
Let's start right at the foundation. Why are systematic reviews considered the absolute gold standard for health decision makers across the globe? Well, a systematic review is a structured collation of all empirical evidence fitting pre-specified eligibility criteria to answer a specific research question. Now, the absolutely crucial phrase to remember here is minimizing bias. You see, the main problem with traditional ad hoc literature searching is that researchers might kind of cherry-pick studies that support their own preconceived ideas. Just as primary research studies use strict methods to avoid bias, we have to do the exact same thing when synthesizing that research. By using explicit, transparent, and reproducible methodology, we basically strip away that bias to provide truly reliable findings.
And what's really interesting here is how this academic definition actually translates into the real world of health economics and outcomes research. These reviews aren't just, academic exercises. They directly inform whether a drug gets licensed or if an insurance company is actually going to cover a new treatment. Plus, conducting a systematic review should typically be your very first step before embarking on any new primary research. Why? Because it prevents research waste. We should absolutely never design or commission new research if it's just unnecessarily duplicating what's already out there.
Moving on to section 2, formulating the review question. Before we even think about digging into the data or searching through databases, we have to define exactly what we're looking for. Getting this research question right is absolutely critical for the success of your entire project. The crucial point is how we actually structure that query, and we do it using the PICO framework. If you're preparing for a university exam or maybe an HEOR job interview, definitely write this down. PICO stands for population, intervention, comparison, and outcome. So for example, your question might be a really straightforward comparison. In a specific population of diabetic patients, does a new drug intervention, compared to standard care, improve the outcome of blood sugar control? The review question dictates the methods, not the other way around. It's the anchor for the whole shebang. Now for section 3, building your review team. So with our architectural blueprint drafted and our PICO question locked in, we really need the right crew. The complexity of this process is simply way too high for a solo researcher, which leads us to a very strict rule. Cochrane will not publish a review that is proposed to be undertaken by a single person. This is a massive beginner mistake. Sometimes students think they can just write a systematic review over a weekend by themselves. You really can't. Working as a team ensures that critical tasks like selecting studies for eligibility and extracting data are performed by at least 2 people independently. That is how we catch mistakes and keep errors to an absolute minimum. So who actually needs to be on this team? Well, you need a solid mix. You need topic experts to understand the clinical nuances, for sure, but you also need methodologists and statisticians to guarantee objectivity. Interestingly enough, the handbook strongly advocates for involving consumers and stakeholders, like patients, policymakers, or guideline developers, so the review actually answers questions that truly matter to the end users. And here's a strict, absolutely non-negotiable rule. Funding of Cochrane reviews by commercial organizations with an interest in the outcome of the review is completely forbidden. No exceptions. A systematic review has to be a totally independent assessment of the evidence.
All right, on to section 4, the importance of protocols.
Listen, if there is one single thing you take away from this entire explainer, it should be this. The review protocol is the most important document in evidence synthesis. Period. Let's look at how this builds our main defense against bias. On one side, we have a priori specification. This basically means planning your methods, your eligibility criteria, and your outcomes in advance, well before you've seen any of the data. On the flip side, we have post hoc decisions, which is altering your rules after you actually see the results of the studies. Making post hoc decisions, like, say, suddenly excluding a study just because you don't really like its results, that introduces severe bias. A priori planning is what guarantees objectivity and transparency. You absolutely must publish your protocol on a register like Prospero before you even begin.
To help authors actually maintain these strict standards, Cochrane developed MECIR. That stands for Methodological Expectations of Cochrane Intervention Reviews. If you're a medical writer or methodologist, MECR is basically your ultimate quality checklist. It categorizes methods into mandatory expectations, which absolutely must be applied, and highly desirable expectations, which should generally be implemented whenever possible.
Let's dig into some of those mandatory MECIR expectations that you have to pre-specify in your protocol. First off, planning the search. Now, here is a massive beginner mistake: restricting your searches only to English language databases. Removing language restrictions in English databases is definitely not a substitute for actually searching non-English journals. Failing to do that, it directly causes language bias. You also mandatorily have to plan exactly how you'll assess the risk of bias in your included studies. You have to plan your statistical data synthesis and plan your grade assessment. That grade assessment defines the certainty of your evidence for your summary of findings table, which is typically restricted to up to 7 essential outcomes.
Finally, Section 5, Data Management and Reliability.
Now we're looking at the building inspectors, basically how we ensure quality assurance throughout the entire execution of the review process. You have to remember the stakes here, guys. Systematic reviews aren't just academic papers collecting dust. They are a highly critical component of legal and regulatory frameworks. Because these reviews directly impact real patient lives and, frankly, multi-million-dollar drug approvals, they have to hold up as perfectly auditable processes. If an inspector or a regulatory body comes in and questions your conclusion, every single data point, every inclusion decision, and every statistical adjustment must be securely recorded and 100% traceable. So how do we practically execute this in the real world? Well, we follow a rigorous 4-step process. Step 1 is software setup. You really should be using dedicated review management software like Covenants or Epi Reviewer. Step 2 is independent assessment. This is where your team members log in remotely, assess the studies for inclusion, and extract data completely independently. Step 3 is conflict resolution, where any disagreements are clearly recorded and resolved. And finally, Step 4 is the quality audit. Using this kind of software maintains an error-free, centralized audit trail. Plus, keeping your data clean right from the start future-proofs your review, making it so much easier to update later on using semi-automation and machine learning. Okay, let's rapidly summarize the highest yield takeaways, especially for those university exams and HEOR job interviews. Point 1. Systematic reviews exist to minimize bias compared to ad hoc searching. 2. Every single review has to be anchored by a specific PICO question. 3. You can never work alone. You absolutely demand a multidisciplinary team that is totally free of commercial conflicts. 4. You must rely on an a priori protocol to prevent post-hoc bias. And 5. Always map your process against the mandatory MECIR standards to ensure complete transparency. I want to leave you with a bit of a provocative thought to chew on. How will you apply the PICO framework to your next clinical research project or health technology assessment? Whether you're evaluating a brand new biologic or running a complex public health analysis, starting with an unbiased, highly structured question truly changes everything. Thank you so much for joining us on this explainer, and keep asking great questions.